name is Dr. Daniel Leonard. I'm a physical therapist as well as strength coach here at Eclipse Wellness in Northern Virginia, and I work primarily with throwing athletes, so baseball and softball players for the most part. And I want to talk about an injury that I see sometimes in athletes that often goes misdiagnosed and underrealized, an olecranon stress fracture. So I think it's important to understand, first of all, what the olecranon is. So the olecranon is the tip of your elbow. It's actually part of your ulna, which is the big bone in your forearm here, and it creates a kind of hook that goes around your humerus, the big bone in your upper arm here. So when I flex and extend, you can see that that tip disappears when I extend because it's rolling into the humerus in what we call the olecranon fossa. So when you move normally, this is what it should look like. No pain, I can get fully extended, no issues. What can happen though, typically with throwing, so especially in pitchers, typically baseball pitchers throw overhand, is you have repetitive trauma to that area from throwing over and over again as we're doing that, which kind of keeps crunching on that fossa, creating damage, creating issues with it, where you have inflammation in that area and then eventually breakdown of the bone, what we call a stress reaction, which can lead to a stress fracture. Now, typically that's going to occur in people who are going through puberty because you have what are called growth plates. Growth plates are kind of spongy. They're on the end of our long bones, so our ulna and our humerus here, and that's what helps our bones grow as we get older and taller. The issue is that area of the bone is softer. That's what allows it to grow, but it's more likely to be damaged. So that's how we typically get stress fractures. You don't see those nearly as much in adults because our bones have hardened and fused and we're not growing anymore, so we don't have growth plates. But in young athletes, you typically see things like that more commonly because the growth plates are going to be the weakest part. So the repetitive extension can damage those growth plates and cause the stress fractures that we worry about. So actually diagnosing a stress fracture can be tricky. A typical good test can just be, does it hurt to extend your elbow? And the pain should be kind of on the inside of your olecranon right here. It shouldn't be over here, which is more going to be your UCL. It's usually not on the tip here. It's usually kind of on the inside there. It'll usually hurt with extension. Like I said, it'll typically hurt with resisted extension. So if you block yourself and try to push into it, which is going to activate your triceps muscle, which is going to run into there. So using that muscle is going to kind of tug on that area and create more inflammation and irritation. So that'll typically be painful. Another test is simply supinating and pronating. That's another motion that we often forget at the elbow, but that can cause pain as well, of kind of grinding in that area and everything like that. Typically extension is worse, but sometimes you can see it with supination and pronation. So those are kind of the main tests that I like to use. You can also do, obviously x-rays can help sometimes. The problem is that when the stress fracture is very small, sometimes it's easy to miss on an x-ray, and an MRI might be necessary because an MRI can show kind of swelling and what we call edema in the area. That's kind of the breakdown, the stress reaction before it gets to a stress fracture, or if there's a tiny fracture, the MRI can kind of see everything around it if you might miss the fracture on an x-ray. Research shows that actually detecting early can be very helpful with stress fractures. Those that are detected within 3 weeks of the initial onset of symptoms, people tend to return back to sport in about 10 weeks, versus those that take over 3 weeks to be determined take about 18 weeks to get back to sport. So it's important to recognize these early and do something about it. That something is typically relative rest, so taking a bit of a break from throwing. If it's not that bad, maybe just backing off your throwing a little bit. And then physical therapy is the primary intervention. Surgery can be necessary. Usually surgeons will wait a while before that is an option because they don't like to do surgery on growth plates, because if you damage a growth plate, then you could cause it to fuse prematurely or something like that. There's a lot of issues that can be involved with doing surgery in that area. Surgery does have a decent success rate. It typically takes about 6 months after surgery to return to your sport. It can take a little longer, a little shorter, depending on the person, but that just gives you an idea. But typically you're gonna try physical therapy at least for a couple months before surgery, just to see if you can get things back conservatively. Physical therapy is gonna focus on a few things. So if there's tension or something in your triceps, like I said, that could be pulling. Using a lacrosse ball or something like that to roll your triceps can be very beneficial to kind of decrease that tension in the muscle. As part of this playlist, I'll have exercises included that you can go look at separate videos, see those. One of those is just rolling a lacrosse ball there. If you're dealing particularly with pitchers, you should be looking at what we call the entire kinetic chain, which is, head to toe, what's moving, what isn't moving, and what could be helpful. Because if we can work on deceleration and slowing you down, then that can help prevent that exaggerated whipping of the arm So the biceps are good for that, but we can also look further down the chain. So an exercise I like to use are what are called hip thrusts, which is essentially a bridge where you're putting some sort of barbell or weight across your waist. You don't need to use your arms. So if your shoulders or elbows are very sore or hurting, you're not supposed to use them, you can do exercises like that without having to hold a weight like a deadlift or a squat or something if you're having to hold a bar. That's also included in the video demonstrations. Another area I like to look at is the rotator cuff and the scapular muscles in your back, because if you imagine if we're coming through and we're trying to slow down, we should be able to pull back with those muscles to save our biceps a little bit and save that area. I like to start with simple bands. J bands are great because once again, you don't have to hold on to them, so that's not going to put too much pressure on the elbow, eventually leading to heavier rows or something like that. Any variation is okay. My videos of bent over rows, anything like that is okay to just work on the muscles back there of getting them stronger. Once you've kind of cleared those areas and you're starting to feel better, I like to then go after the biceps because, as I mentioned, when we're throwing, our biceps are working what we call eccentrically to slow down your arm and prevent stress on the elbow. So eccentrically is when the muscle's lengthening. So simple bicep curls are great, focusing on lowering down slowly, controlling it, going all the way down, and then coming back up. You can do two hands, you can do one hand, whatever's easiest for you. Once you've gotten through that and you're feeling better, you can start some direct work on the triceps themselves, because it's important not to neglect those. We do use our triceps for throwing, and a muscle that's weak will tend to get tighter. So we want it to get stronger and then actually help it get more mobile. So the early exercise I like to use for the triceps are not putting it in too aggressive of position. I like a simple pull down or something with bands where you're going with gravity, your shoulder's not in a provocative position, it's easy to scale. That's a great way to introduce it before eventually transitioning to kind of overhead extensions that are putting a little more stress, but it's more replicating what a throwing motion looks like before you get back to a return to throwing program. So hopefully this gives you some ideas. Like I said, there'll be other videos in this playlist that'll kind of show you some of the exercises that I typically like to use. There's a million variations you can use, but it should just give you a basic idea. If you have any questions, please comment below. Reach out if you're in the area. I'd love to work with you. Like I said, Eclipse Wellness, we're here in Northern Virginia. Thank you for watching, and hopefully this was helpful.